Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode of Health Watch on Advent Cable Network Nigeria. I am Angela Mweze. The fertility rate in Nigeria is estimated to be 5.4, implying that the average woman in Nigeria can expect to have an average of 5 children. Yet, many Nigerian couples experience infertility. In a society like Nigeria, couples who cannot conceive often experience emotional and psychological trauma. Furthermore, it is strange and really unfair that in this same society, women are mainly blamed for infertility, hence ignoring the fact that men also experience infertility. When our large population is considered, it is difficult to believe that we have a problem with infertility, but we do, and that is what we shall be discussing today. We shall find out what is responsible for the increasing rate of infertility amongst couples. And at some point in this program, we'll also talk about miscarriage, which is also a scary and dreadful experience for couples. You don't want to miss any part of today's program because we have a lot to learn and I'm excited about it. My guest on the program today is Dr. Maxwell Odiegwu, a medical director at Medimask Hospital, Abuja. You're welcome to the program, sir.
Thank you very much.
Thank you for coming back. The last time we talked on fibroid, we spoke on fibroid and that was extensive. So it's good to have you back on the program. So today we're going to be discussing something that is sad and painful to talk about. And I really want you to help us, explain, because we want to learn a lot today on the issue of infertility. Couple who have tried and cannot have children. And I know how painful it is in this part of the world when people don't have children, say after 1 year, 2 years, and they are all worried. But first of all, before we even start talking about infertility, I want to know what exactly is infertility? Are we getting it wrong or are we getting it misconstrued? What exactly is infertility?
Infertility should not be it's not synonymous with barrenness.
Okay.
There's a new word now. We call it subfertility.
Subfertility. Okay.
Nobody is infertile. Before a diagnosis of infertility is made, you must have done a lot of tests to now say this person is
infertile,
cannot or has a reduced capacity to achieve conception. So we use subfertility. What it means is that, it's not enough for something to happen. So you may need some form of intervention by way of investigations and medications or any maybe technique or whatever. So we use subfertility most because when you say infertility, it's like you're keeping a particular set of people on one side. They can't ever get pregnant, but we all know that there are new technologies that can help at every point in time for us to achieve that.
So my whole story on infertility is actually the wrong word to use.
No, infertility has always been the word, the medical word. And it has a definition.
Okay.
And we are coming to that.
Okay, so what is the definition of this infertility? So now we know, first of all, that it's now subfertility. That's when there is a delay. Or is that what it is?
When there is a reduced capacity for whatever reason, of which we do not know.
Reduced capacity to conceive. Then you say it's subfertility.
Yes.
But then the infertility itself, now, what's the definition of that?
When there is inability for a couple to achieve conception after having several unprotected, frequent sexual intercourse within a particular period. You now say that, there may be some infertility. but we don't know why it is so.
Okay, so if a couple has been meeting consistently for the period of time we're looking at, do you have a period, is it in years?
12 months.
12 months is what we're looking at. So if a couple have been meeting consistently for 12 months without with an unprotected sex for a period of 12 months, then you say that the couple are infertile, but we don't know the reason why they are until we know, then we treat. So infertility is not a constant, a blank check that says you can never have children.
Yeah, because it's just in some areas there may not be enough equipment to do more advanced investigations to really know why this is happening. Before you can now say, even though there is an entity also called unexplained infertility.
So you've checked everything and
everything is fine, but nothing is happening. It doesn't mean that you shouldn't seek treatment, but that's just an entity which is recognized.
Oh, I see. Okay, now that's clearing a lot of things now. All right, okay. So why would a couple be meeting? Because somehow in my head, once a couple meets, they're supposed to get pregnant, which is the normal, natural process.
That is a very erroneous impression. Human reproduction is highly ineffective, and that is how God made it. Pregnancy rate in a month should be about 20%, no matter how you try. Unlike animals, when a female dog is on heat and a male dog comes close, there must be pregnancy. It's not same for humans. Otherwise, there won't be any space left for us on this planet. So that's how God made it. That 20% means that some people will try that first month and it happens. Some will need to try for a few more months before it happens. That's for those that we are assuming have natural parameters. So that is why we say, when we define, you have to wait for 12 months. Before you can say, okay, let's start investigating for humans.
So if there's a couple watching now and they've been married for 6 months and nothing,
and they've been
trying for 6 months, they should have it in their mind that every month there's a 20% chance. Is that what we're saying?
Yes, for each month.
For each month.
There's a 20% chance.
20% chance. So if you don't get pregnant in month 1, you know, there are some people that come and try to rub it in and say, oh, first touch and I'm pregnant. Well, that's the chance fell for that person, but it's not consistent with everybody.
It's not.
So you must keep trying for a period of 1 year. That 12 months is
so
1 year.
So when such couples come to us and they've been married for only 3 months, we only reassure them and tell them to keep trying.
So
but there's a small clause there. If the lady is 35 years, we may not want to wait till the end of 12 months. At the end of 6 months, we may need to start investigating. Then when you are approaching 40, we don't have to wait at all to investigate.
All right. This has to do with the age now.
Yes.
So if you've gotten to age 35, and after 6 months of constant unprotected sexual intercourse as a couple, then you go seek. We start investigation.
You don't have to wait for 1 year.
You don't need to wait for 1 year.
Yes.
And then if you're older than that, of course, the chances. So in other words, as you get older, the chances, it decreases.
The female's age is the single most important factor. Because it has a direct correlation with the quality of eggs.
All right.
So as one gets older, the amount and the quality of eggs tends to go down. In fact, the rate of loss of those eggs, that's the begins to fall much faster.
Faster, okay.
From the age of 35.
Okay, so of course, when the person is younger, you're producing lots of egg and eggs.
No, they've already been produced.
They've been produced, okay, of course, yes. Oh, yeah.
So at ovulation, they get activated every month, like that. But as they are getting older, the rate of loss is more. Okay,
so if I'm taking something from this particular this thing, reassuring people, because, you know, it's very easy for, it's a traumatic event in this part of the world. After 3 months, 4 months, and people are not seeing you doing something funny, they start knocking out, when is it coming?
That's true.
So whether it's mother-in-law or father-in-law that is watching, or daughter or couple watching, 6 months, 7 months, 8 months, you should just keep trying. You know, there's also chances that you get pregnant. But if you're over 35, then, you know, you don't need to wait for that long to go and seek for help, you know, or get people to start investigation, which will help. Okay. All right. That clears a lot of things, which is good. So now, what can actually cause a delay? You know, after, there are some couple, after 12 months, you know, they won't have children, they won't have any conception, or they won't conceive after 12 months. So what could be responsible? Now we're looking at cases where what could be responsible for causes infertility. But I want to start with, because there are 2 people involved.
Yes.
And let me just clear something. Is it always a woman's fault if there's no conception? Of course, we've talked about the age. Yes, but is it always a woman, or is the chances odd against the woman more than the man in the marriage, in the relationship?
It's 50-50.
Can you say that again?
50-50.
50. So it could be the man
or the woman.
There's a 50% chance that it could be the man, and there's a 50% chance that it could be the woman.
Percentage causes 40% from the man.
Okay.
40% from the woman. The remaining 20%, we don't know. We don't know why. Unknown.
We don't know why. Okay, it's unknown.
So it's more like, you know, equal representation, if I may use that word. Okay. So for us, we know it takes 2 to tango. So whenever a woman comes, we ask for the partner, the spouse. Okay. Because there's no way we can investigate the woman when the man is not there.
He's not there.
And we have been seeing a lot of male factor problems in the past few years. So it's not a woman's fault at all. Men have also been responsible at various times. It's just that the culture does not allow the man to come out and be
subjected.
So it makes the person less of a man if it is found out that he cannot be able to achieve conception through that. So even when the woman knows, she's not too forward about it. She wants to see how she can first of all check herself, then we'll now see whether the man needs to be checked. Okay.
So the issue of infertility amongst couple is both of them have to be involved in it. It's a balanced equation. I'm glad we've been able to clear that. So whether you're watching us, you're a couple, or you're going through the challenge, it's a balanced equation. Husband brings a part of it, the same equal percentage into it. So it's important, while looking for a solution, both of you go together, come together to find a solution. All right, let me start now with the male folk. You know, what could cause a man, you know, when you just think of it, the only thing that everybody talks about is low sperm count. And that is all the thing is believed to be responsible for a man's inability to impregnate, you know, another, his wife or spouse. So what are the factors that could cause a man, you know, not to be fertile, if I use that word?
We have to, let me see from your perspective. The truth is that sperm is the most important factor, whether we like it or not. And you must have healthy sperm to be able to do anything. The sperm has to be motile, ability to swing, to meet the egg, very, very important as well. Like I said, the healthiness is so important. It mustn't be there mustn't be any distortions or the type, either it's as morphology and all that, you know. So those are very important. And you see, low sperm count is more like an aftermath of something.
Okay. So somebody just not born with low sperm count, or there could just be exceptional cases, but it has to, something has to lead to it, or?
Very well, 2% of the male population is sterile, maybe born like that.
Okay.
But you see, these sperm problems is not only peculiar to our country, even in developed countries, they've noticed that there is a decrease in sperm counts.
Okay.
And a lot of things have been attributed. I'll probably start and say that, okay, there's maybe some factors that may be responsible. Smoke, some dietary
factors,
yes, like alcohol, smoking, and infections also over time may have caused problems alongside, so that even when you treat the infection, the fertility is not restored. I know there are the anatomy of the area is such that there are some tubes that transport these things to where they are needed. Once there are problems there, maybe by way of blockage or scarring, it becomes a problem. That's delivery.
Okay.
Then there is what we call varicocele, the veins that drain the scrotum where the sperm is being produced. They get dilated for one reason or the other. When that happens,
when you mean dilated, they expand.
Expands.
Yeah. Okay.
So when that happens it tends to impair sperm production.
Okay.
People have questioned processed foods, because you see, sperm production is a 90-day cycle.
All right.
It's a constant thing.
Okay.
That's why sperm parameter can be okay today. In 3 months' time, you cannot guarantee. You may have changed for one reason or the other.
Okay.
So that's why we always want to constantly check. Someone that had a good sperm count 6 months ago may not be the same again.
Okay, does it just happen? So what you're saying now is the factors that could affect the quality of the sperm would have to do, number one, lifestyle. Because I know there's an increase in alcohol consumption, because this alcohol could be an issue. Then smoking. Then the 90-day cycle, you could have this season you have quality sperm, and then in the next, so this changes in the quality of the sperm production, does it have anything to do with maybe the food you eat, or it just happens randomly, or is it because of the alcohol and the smoking that we've gotten ourselves involved in? Because I know men, it's becoming a serious thing. Men are having, issues with infertility.
These are some of the things that I just mentioned. There are some other reasons why too. There are some hormonal problems.
Okay.
And hormones are also involved in the production of sperm.
Okay.
So when that happens as well, it affects its production, so that we don't even have enough to work with.
Oh, wow.
Then some people, maybe when they were born, they had some problems. They all call undescended testes.
Oh, does that come out to be a problem?
If it's
not corrected. Okay.
Because the testis is supposed to, it develops in the abdomen, but at birth it tends to now come down to its final destination, that's the scrotum. The temperature there is better than in there. So if it remains in the abdomen, the temperature is not very conducive for sperm production.
Okay.
That's the same reason why they advise against wearing very tight undies.
Okay, for men.
That are not, that doesn't allow a lot of air.
Okay.
Then they also discourage sauna baths, all those hot baths, because they can also impair.
Okay.
So A lot of things, even mumps for young males.
Mumps?
Yes, it's a viral infection.
Okay, yeah.
Tends to affect sperm production later in life. So a lot of things may be involved. There are some chromosomal abnormalities too that can also be responsible. Those are not as common as the other reasons. But I think in this part of the world is more of infections.
Infection.
And you see, many people are prone to such things. And remember that I'm just giving you a scenario now. Someone that probably got married early and has 3 kids or 4 kids. Maybe he wants more, but because there are problems, he won't even bother anymore because he's already there. Unlike people that are just trying for the first time. But it's not the cost that we should too much be worried about. It's what we should do.
What you should do
about it.
Okay, so when can a man go and find out, probably before you get married, you go and find out if you're fertile? Is this something that is advisable, you know, to check these parameters? Because after this, the next question I'm going to ask, what kind of infection and, you know, would have caused a man to have the problem they're having? But is this something that's advisable as a man? Because I've never heard any man go to check, or heard anybody say, I'm telling my sons to go and check their fertility. You know, it normally comes out after they're married or something. Is it advisable to check some of this? Yeah,
the only test you probably want to do is still the sperm test, that's seminal fluid analysis. To just have an idea of what is happening. You know, some men will probably want to try before they even get married to see whether anything will happen, which is not the right way, though. You can go to the laboratory and try and see if, just to have an idea. Just to have an idea of what is happening. Unfortunately, that's not the way it is. It's more of fertility test for the woman.
For the women, yeah.
To see whether
she's
but
okay.
It's not even, you can do your fertility test and everything is fine. Can it still be a delay for whatever reason? Yeah, because the tests you are going to do are not that comprehensive, more of basic tests.
Okay, it's only when there's now an issue, then you start doing more comprehensive and doing all that.
More advanced.
Okay, you talked about infections.
Of course, it has to be sexually transmitted
infection.
It can't be anything else.
Okay, that would be, let me remember the sexually transmitted disease that I know. Diarrhea, gonorrhea, syphilis, chlamydia. I think those are
more bacterial
infections.
Yeah, even so, you know, the thing about these infections is it may be there, it may not be full blown, it may be subtle. Over time, causing minor damages. By the time it now gets very serious, there is little or nothing one can do. The infection can be treated, but the damage that it has caused cannot be sorted out easily.
So the best thing is just stay a little bit away from the sexual
that's what they say.
intercourse. The abstinence is still the best thing you keep yourself from. Okay, so when the man then finds out that he has a problem, what do we do?
Well, there are different options. A lot of things can be done for the man. You know, there are different degrees of problems. It may just be, maybe the sperm count is slightly low and the motility. You can start taking certain medications to see whether it will come up. Following investigations, we have some people that, we have andrologists, we have urologists that can look into it and now do further investigations and see what can be done. Treatment will follow, but the outcome of treatment we can't really predict. So after a 3-month period, we repeat the sperm count again and see how it is. If there is marginal improvement, we keep on working on it until we are comfortable that, okay, this can help. Maybe if you want to try natural conception. But thank God for assisted reproductive techniques even men that have very low sperm count with IVF, they can be able to fertilize, because what happens is this: the sperm count may be low, but the ability to impregnate is still there.
Okay.
So with the assisted reproductive techniques by way of ICSI, the good ones that are available are picked and injected directly into the egg. So the issue of is swimming to meet the egg and the rest
it's just taking off.
It's taking off.
Okay.
So, and this technology is barely 20 years, 25 years old. Before now, there's nothing you can do, no matter how you try.
Yeah.
Even if you meet your wife every day for 1 month, nothing is going to happen as long as the sperm count is low.
Wow.
So, with these new technologies now, it's also part of IVF. As long as your wife is fine, then we are good.
Yeah, I don't want to talk too much on IVF, but I just want to touch a little bit on it. You know, so many people are not comfortable with it. I don't know. They have a mindset that it is against the natural process of conception, and it feels like you're playing God and trying to twitch what God is doing. What do you think? What's your opinion on that?
I don't think someone that has been trying to conceive for 20 years shares the same opinion. Yeah. This was an impression that was also played out in the days of the pioneers of IVF 40-something years ago. But now we know that IVF has solved a lot of problems in many families. More than 6 million babies have been delivered by IVF worldwide.
Wow.
And I don't think it's that. We are just trying to augment and assist the natural process.
Okay.
That's simply it. There's no... I don't
think it's not playing God, because if you're struggling to have children and you're given the option, you will take it.
Yes.
Somebody who will say that is somebody who is not struggling to have children.
And even for IVF, it's not every time you do IVF that you succeed.
You succeed. Okay.
Just to still show you that man is still not. So we are still trying to do our best. It's not 100%.
Okay. So we're going to go on a quick break. When we come back, we want to switch to the women. You know, what could cause a woman to be infertile and not able to take in, within the period. Since people like to blame women, let's end this today. Okay. Thank you very much. Okay, we'll be right back, viewers.
I wouldn't want to say we're in a state of anarchy, as it is, because no one is sure of his life walking on the streets anywhere today in the Federal Republic of Nigeria. But in the words of national security, I think we are in a state of emergency.
Nobody will say that what is happening in the country is that. Anybody that says that is very, very economical with the truth.
Once a law is made in any nation, nobody is above the law. If a church has a business entity, the church should pay their own taxation on whatever business they have that they are making money.
Election is not war. Soldiers must not be mobilized for election. Election is a civil affair, and I'm saying that to the federal government. Police has a primary responsibility in protecting the balloting process.
Welcome back, viewers. Before we went on the break, we were discussing infertility, and my guest is still Dr. Maxwell Odiegwu. Thank you very much, sir.
Thank you.
So we've handled the men and we've talked about the issue with them. So number one, I'll still insist that the issue of infertility is not for the female alone.
At all.
It's a 40% chance for men, 40% chance for the woman, and then there's a 10% chance, which is unknown, but it's a balanced it's a balanced percentage, so nobody is to be blamed. And then we've looked at the fact that men, infection, previous infection, lifestyle could be responsible for the issue of infertility amongst the men, and that's just a few out of everything we have discussed. So I know the viewers will that have been following us. So the next one is for the women. And what would make a woman not take it after a long period of time, you know, of trying? It's really painful for the women. I think I'm even emotional towards the women and maybe just being a bit biased. But what are the things that could cause a woman? Now, from the beginning, you talked about barrenness as being different from infertility. Can we just know the difference now? Barrenness. When you say barrenness, is it?
Is a layman's word.
Okay.
It means you have done everything possible and you still could not get a child. It's like you are being condemned. That no matter how you try, you can't even.
Have you seen a woman that got to that stage and no more hope for you?
The only reason why someone can be okay, if you say you are barren, maybe you were born without a womb.
Okay, then there is no. All right.
But for every other reason, there is a very good chance of you having a child, even at 60.
All right, but okay, that's when you've not born with a womb, and maybe you've had your womb had been
has been removed for whatever reason.
Okay, for whatever reason, then you can
understand what I mean?
Okay, now that's conclusive, because that was a bit that was a bit of a hard one. So why would a woman be unable to conceive? What are the things that would have caused a woman be unable to conceive for a period of time?
Conception is a very complex process.
Okay.
It takes a lot for us to get to a positive pregnancy test.
Okay.
A whole lot.
All right.
For the woman, a lot is needed to come together for that to happen.
Okay.
Apart from the sperm now, ovulation has to be up there. It has to be top notch.
Okay.
The tubes have to be open.
Okay.
And the womb should also be in good condition.
Okay.
So, and all these have to come together, synchronize, and make that conception happen with the assistance of the male factor, that is the sperm.
Okay.
So it takes a whole lot of activity by all the parties. So once there is a problem in any of these things that I mentioned, there won't be any pregnancy.
Okay. Now, you talked of the tubes being opened, and I've heard that word constantly, blocked tube. What's blocked tube?
Blocked fallopian tube simply means that something has made it not to, the sperm meets the egg in the fallopian tube. Okay. When there's a blockage as a result of infection most of the time. Okay. That cannot happen. And when the tubes are blocked, there's no way one can conceive naturally unless the tubes are open.
Okay. Let me remember my biology of the cervix area. You have the fallopian tube, which is on the top, and then you have the uterus coming down. You have the cervix, and then the vagina.
Yeah.
So the fertilization, that's the word, where the sperm meets the egg, is somewhere midpoint the fallopian tube.
Then when the embryo
is formed, then it descends and then implants,
and now implants in the
uterus. So when you have the blocked tube, is the egg cannot, do you experience the ovulation? Is the egg released normally?
Yes, at ovulation.
At ovulation the egg is released, but there is no place for the sperm to meet the egg. So because that doesn't happen, of course there will never be any form of fertilization.
And nothing will happen.
The conception.
Yeah.
Oh, I see. So that's what you say, blocked tube. So what kind of infection would have caused it? Because I've heard this word constantly, blocked tube. And when they say blocked tube, it just looks like can't it be removed by surgery, or it's just a case of let's then go to IVF, get an external help?
We have 2 fallopian tubes.
Okay. Yes, of course, yeah.
If one tube is blocked, the other one can do the job. Or let's say one tube is damaged, the other can do the job. You can have all your kids with the other tube. So when you say blocked tubes, you are simply referring to the fact that the 2 tubes are no longer functional. But if it's an infection that is causing the blocked tube, whatever is affecting one tube should also be affecting the other, because it's an infection. Passes through the bloodstream, you know, and gets there.
Okay.
So infection is not, it doesn't just happen today and you see the effect right away.
Okay, okay. So when we're talking of infection, we're looking at the same sexually transmitted infection. That would just be it, or there are other infection, because women have a lot of, even when you use the badly used toilets that is not properly clean, everything just goes south and gets bad. So what kind of infection are we looking at? And is it just everybody who has the infection then must have some form of blocked tube or something?
Remember that the way the woman's body is made, you can also have infections going on in the pelvic area without her really knowing.
Okay.
Sometimes it may not be well treated.
Okay.
And the process will continue without you knowing. It may take 3 years, 4 years, 5 years.
All right.
For everything to happen, for some damage to occur.
Okay. Yeah.
You may think, okay, I'm fine. I'm seeing my menses. Many people feel that when they see their menses, they are fertile, but it's not entirely so. Menstruation, ovulation are 2 parallel events.
All right.
They are 2 parallel events. So if you are seeing your menses, it doesn't mean that you are okay.
Okay.
Ovulation is even a better, if you ovulate, is a better, let's say, parameter for us than menses. Some people don't see their menses every month and they get pregnant.
Okay.
Because they are ovulating.
They ovulating.
Or they ovulate from time to time, for example.
Okay.
But seeing your menses doesn't mean that you can get pregnant.
Okay. Okay.
And there's one concept I want to bring in now. There's what we call biosocial gap. From the time sexual intercourse starts in an average woman till the time she decides to have a baby or get married or something, it's usually like minimum of 10 years or more.
Okay, wait, let me understand that. So the social gap, biosocial gap,
yes,
is so the lady has become sexually active
till the time we want to have a baby or marry or
want to get pregnant. Okay, that gap,
a lot of things happen.
Okay. All right.
From dating, mistakes, many things.
Okay, so in between that biosocial gap, that is where the destruction happens.
If it's longer, it's not good.
Okay.
If it's shorter, it's better. That is why in some parts of the country, when they marry early, they get pregnant quickly.
Okay.
Because the system is more or less more intact.
Okay. All right. Oh, I see. Okay, okay. Now we've talked about the blocked tube, but that can be treated. Can it be handled?
Yeah, it can be treated, but the damage that it has caused
Okay, is what the problem is now.
Before the advent of assisted reproductive technique, we could go to theater and see whether we can do some tubal repair.
Okay.
But success rate for tubal repair is about 10–15% then.
All right. Okay.
That was the only thing that we had.
Okay.
But now nobody even bothers.
All right.
Because
because
10,
we have
10 over 100 is not good.
So it's not good.
So why would you go and, you know?
Okay, so that's one. So what other factors again? We've seen blocked tube.
Ovulation problems.
When you say ovulation problems,
they call it anovulation.
Okay, okay. So what would that be? You're not ovulating.
You're not ovulating.
And of course, ovulation is when egg is released into the tubes. You're not ovulating. Okay.
But we do certain tests to determine that.
All right. Can a lady check? Because you said ovulation, the fact that you're seeing your menses does not necessarily mean that
sure,
you are okay. You know. But can somebody go and check, oh, my ovulation, am I ovulating well?
Yes, why not? But you see, the true test of ovulation is pregnancy.
Pregnancy, oh, right, okay.
So if someone has gotten pregnant, she probably is more relaxed. Okay, I'm fine. In the past.
All right, so ovulation issues. So that's hormonal. That should be an hormonal.
Yes, that's why we do hormonal profile and all the other tests.
Okay. And that can be treated. That can be treated in the hospital. Can be corrected.
Yes. In fact, most problems result from that. By the time you do your tests and they come out, we will need to give some medications to help with the ovulation and pregnancy, of course, if every other factor is fine.
It's fine. Okay. So we have ovulation. So we've seen the blocked tube. We've seen
infection. That's the commonest in this part of the world.
Okay, infection is what is responsible.
Yes,
so if you're being promiscuous and being unreasonable, it's not advisable. This is the right time to stop it.
At all.
You know, because you're endangering yourself if you are having multiple partners and being careless about section.
You know, some will feel that they are not having any symptoms. Despite that, they are fine. But you see, people come with different traits and strains.
Yeah.
Over time, it may become obvious.
Okay. Okay.
You know, sometimes the lady thinks that she's avoiding pregnancy by trying some methods, maybe trying to stay away during ovulation or taking medication. It's probably at that point that you're even not capable of getting pregnant.
Okay.
But you think it's the medication and your
strategies
that is making you not to. So when it's now time for you to get pregnant, that's when you realize that it's not even happening.
Okay. So
and most of the time is when you are about to get married. Because when you are not ready to get married, you want to go and check whether you can get pregnant. You feel that you can get pregnant, but you are avoiding it.
Okay. All right. Okay. Avoid. Okay. Because everybody thinks that way.
Yes.
I'm okay. There's nothing wrong with me. I'm not.
Especially if you're sexually active.
Okay.
And you have multiple sexual partners. It's not advisable.
It's not advisable because it's a problem waiting in the future. But I've had cases of women who don't even see period or see very little, almost next to maybe every 3-4 months. They don't see their period or it's seized or something like that. I've heard 1 or 2. What could be responsible for that?
There's a need for further investigation.
Okay.
It's not normal. You're supposed to be seeing your period every month.
Okay.
Or over a period. The minimum is 21 days, maximum 35.
Okay.
Anything below or more than that will need to be investigated.
And
it's the irregularity that we are concerned about.
Okay.
If it's irregular and it's coming, even if you flew for 1 day, it's in order.
It's in order.
If it has always been like that.
Okay.
Not that you've been flying for 5 days and you're now flying for 1 day.
Okay.
That is the problem.
All right.
That needs to be investigated.
Okay. Then what of the issue of people who don't have irregular periods, you know, you can see it at the beginning of the month, and then later it goes to the middle of the month, and then later it goes to the end of the month. But you see it regularly.
Yes.
But it's changes, you know, you don't have, because I've seen those kind of cases. Would that be a problem as well? Or?
It can be,
Okay.
especially if it has to do with you trying to get pregnant. And you know, when the patient comes to the hospital to see the doctor, further specific questions are asked.
Okay.
Want to see the pattern. Someone can see the period on the 1st of the month and see it on 28th of the month. It's still okay.
Okay. Okay.
Because the interval is in order. And you see it again the next month, but towards the end.
Okay.
Because it's short.
So
okay. You're not expected to be seeing it on the same day or close to the same day of the next month.
All right. Okay.
As long as the pattern is in order, then we are fine with it.
We're fine with it. Okay. So we've looked at all of that. So what other factors could have? I know I've heard there's a word I've been trying to remember, but it's not coming to. I think it's the hardening of the uterus. You know, where it's difficult. I'm trying
Endometriosis?
Yes, which so
endometriosis is also a factor. Before now, it used to be said that it's not very common. Probably people that suffer it don't come out. It's not a very easy condition because the symptoms are even as excruciating.
Yeah, because I know it's very painful.
Painful periods. Even after periods, you still have pains. In fact, the pains continue to the next period. You know, so it can be difficult for those that suffer endometriosis to even get pregnant.
Because probably even if they try to implant or conceive, it will still be very difficult.
Yes, it can be difficult because what happens is that endometrial tissue, that's the inner lining of the uterus, are found in other parts of the pelvic area, causing pain. And when they now heal, they cause scarring. And the scarring can cause problems as time goes.
Goes on. Okay, so that's okay. Those are the factors we're looking at that could make a woman find it difficult to conceive.
Yes, uterine fibroids is at the lower rung of the ladder.
Okay, I was just about to ask that.
That was the reason why I didn't mention it from the beginning. But the general impression is that when you have fibroids, you cannot get pregnant. It's not entirely true, because we have seen many women that got pregnant with fibroids, and they carry the pregnancy to term. What usually happens is that apart from the fibroids, there are other things. Maybe like blocked tubes.
Which is not known.
Yes, but the fibroid is what you see.
What you see,
You know?
Yeah.
So fibroids may not be the problem. Before you can say, okay, you can't get pregnant, you should first of all rule out other causes apart from the fibroid. Fibroids can easily be removed. And if it's the fibroid that is the problem, the lady will get pregnant.
All right. So fibroid cannot prevent you from getting it's very almost.
There are some scenarios that fibroid can prevent you from getting pregnant. I'm going to mention them. Sometimes when you have fibroid in the cavity of the womb, where the fibroids are located is not rich enough for implantation to occur.
All right,
So if there are too many of them, following fertilization, the embryo tends to look for a very rich, we call it facultative, a very rich area in the womb to implant. So when the womb is riddled with fibroids, it becomes difficult.
To implant.
That is one. Secondly, theoretically, they say when you have fibroids so much that where the uterus meets the fallopian tubes, the orifices, if they are blocked, of course, there won't be any way for the process of conception to continue.
Okay, so those are the two cases where fibroid can become an issue. So it's dependent.
It can become an issue.
So it's dependent on the position. Of the fibroid. Okay. So there are people who say that if you use lot of contraception, over a long period of time, it has a way of bringing about infertility. I don't know how true that is, because I'm just trying to dabble into some of my myths. I wanted to, you know, when you're using the normal, the pills.
Emergency contraceptive?
Well, you know, young people who are just being careless, you know, just take things to prevent.
No, first and foremost, it's not even advisable. It's called an emergency contraceptive. What it simply means is mistake. You are not too sure. Oh, it happened. Let me quickly do something about it. But I know that the young ones, what they do is that they even have it in their bags and they take it from time to time. Of course, their hormones, they are going to distort a lot of things later, so they are not even very advisable. They are not advisable.
But do they in any way cause infertility? You know, it's one thing to say it's not advisable to do something, but there's another thing to say.
They are going to distort the hormonal milieu, and eventually it's going to, it may lead to problem, because the way it is being abused is not the way it should be taken.
Okay, so we've looked at a lot of things that could cause women to have difficulty in taking in. So we're looking at the endometriosis, we've looked at, okay, before I just run through all those things we've looked at, where's the place of diet and the women with conception? The diets or the way we eat or the lifestyle, does it play any role for the women? Because there's some women that might not do all these things and still struggle to have children. They might not have had any, they are what's that word again? The social, this thing wouldn't have been so much. They wouldn't have done anything, maybe lived carelessly or done it, but still struggle to
of course, social habits also has a role to play. Smoking has a role to play for the women as well.
Smoking?
Alcohol, maybe not much. Moderate alcohol may be fine, but not too much.
Okay.
Drugs, illicit drugs, also a problem, both for the man and the woman. Then we have also noticed that weight changes, even for the man.
Could be responsible.
Yes, because what happens is because of the weight, the hormones that are supposed to be in the body will now not help to produce what we need to. And for the woman, too much weight or too little weight.
Little weight?
Yes.
So when you're underweight?
Underweight.
Okay.
And overweight.
Overweight.
They become a problem. Okay. So when we come in, there's also an entity, polycystic ovarian disease, polycystic ovaries.
Okay, okay. What's that? Polycystic?
It's an entity. It's a disease condition.
All right, okay.
What happens is that they come in, some hormones are not okay, so instead of producing eggs, more of cysts in the ovaries. And a lot of things have been attributed to it. In fact, even diabetes has also been associated with family history.
Okay.
See some women that have a lot of hair.
All right, okay. In the chest and sometimes
and all
under
that.
Okay.
Ovulation may be a problem in some of them.
Okay.
In most of them. Some people still conceive though. Okay. But those are signs that there may be problems. It means they have more male hormones, that testosterone, within the system.
Oh, that's possible?
Yes, they have.
Oh, okay.
Just like men too may have less male hormones, that may not impair with sperm production.
Okay.
So for polycystic ovaries, they may be bleeding excessively, or they may not even be seeing periods regularly. Most of the time, because of that male hair distribution, then they may also be on the big side as well. You know, so anybody that's on the big side and trying to get pregnant, we always advise that you should lose some weight. With some weight loss, you may not even need any medication. Everything will just come back to normal. Okay,
with all these things we've talked about now, the solution to it will be actually to see a gynecologist who will look at your profile and then prefer a solution for you, you know, on how to go about it.
You don't really waste time. Once you suspect that there may be a problem, you know, the truth is that some women even know beforehand if there's a problem.
Okay.
Maybe the period that you've been single, you notice some changes in your body. That is the time for you to check yourself out.
Okay.
If there are problems. There are some problems, situations that may not need any medication. They come in like that. Okay, this thing is there. We say, okay, madam, don't worry. When you are trying to start a family, then you come.
Okay.
So that we'll now see what we can do. Because even when you give medications, everything will be all right. But when you stop the medication, it comes back.
Okay.
The goal is for you to get pregnant. So we just wait till that time.
For something
some hormonal situations like that.
Okay,
then sometimes pregnancy has a way of even altering and making everything okay, so that you don't have to come in a second time if you want to have a baby.
Okay.
Probably have corrected something.
There's some things that are there. Okay, so the important thing is if there's a couple having difficulty, both of them.
Yes.
So it's now not the woman going to the hospital every day to look for a solution, or the man, which is very rare, to go look for a solution, but both of them can come together, and if they can come find the solution as a couple, there's this possibility that they can actually, you know, surmount whatever the challenge is.
Yeah.
If that's the message we're going to be giving to our viewers today, is the issue of infertility is not this is the end of the case. There's always hope.
There's always hope. There are a lot of things that can be done.
Okay.
At the end of the day, stepwise approach. You start from this level. If you are not making any headway, then you move on to another level of treatment.
But the important thing is that if you're under 35, you have constant unprotected sex for a period of 12 months before you start thinking that there's anything wrong.
Yes.
Constantly. And if you're over 35, watch between 6 months and then go seek for help. And if you are getting over 40, 45, then from the beginning you should start. You don't have to wait for that. Okay, before we go, because we're already going, I must clear this thing that has been, in fact, I heard somebody, they've told me so many men have come to say that if a man hasn't had any form of sexual intercourse for a long period of time, the sperm will ferment and probably burst. So somehow he needs to get rid of the sperm content, and that is why he must have some form of sexual intercourse. And this has been sold to a lot of people, and these people have the defense. Please, is there any truth in this?
Well, it is more of a myth than fact.
Okay.
Even though sexual intercourse is good for people that have gotten to the age for you to. But when you now say that if it doesn't happen, that you're going to die or something bad is going to happen to you, I don't think there's any truth in it.
So that's just about looking for solution to
because there is always the urge will come after some time. So, you know, but nothing is fermenting and nothing is going to burst anyway.
So it could just be one of those stories men bring up.
Yes, to
have sexual intercourse and deceive somebody. Okay, so there is no truth in it, young man. If you're watching me, there is no truth in it. Your stomach will not burst because you didn't have sexual intercourse.
Because the process of production is a continuous one. If nothing happens, keeps on producing. The ones that are there, the old ones will die, and new ones will be produced, just like blood cells.
Okay.
So it will not be too much.
All right. Thank you very much, Doctor, for coming on the program. We have exhausted our time. We're supposed to talk about miscarriage, but we will not do that today. In the next episode, we'll talk about miscarriage. That's another issue that very dreadful issue that couple have to face, you know, in their marriage. But we'll talk about it and see how to help people get solution from it. But thank you very much for coming on the program.
Pleasure.
It's good to have you back, and I hope to see you next week for more on this discussion.
Thank you.
So thank you, viewers. We've been discussing infertility, and I believe you have learned a lot today. And I hope, if there's still hope for couple that are struggling to have kids, there's a lot of help out there just for you to seek for one. And, you know, God being our help will help us find a solution to all this. Thank you very much for joining us. I've been speaking to Dr. Maxwell Odiegwu, and he is the medical director at Medimask Hospital. Thank you very much for joining us. I am Angela Nweze. God bless you.